All right, so what we're doing here today is called a fibular repositioning taping. This is most likely indicated for people that have recurrent ankle sprains where they would kind of turn the ankle in and sprain it that way, which is the most common way to sprain it. And this kind of pulls the foot in the opposite direction. So this is something that could be kind of a temporary measure to help a person like that out, give them just a little more stability in the opposite direction. So for the purpose of this, we are going to use two different kinds of tape. One is called coverall, which is this white tape, which basically just protects the skin. And then another type is called leukotape, which is this thicker tape that's actually going to do the repositioning for us today. So what we're going to do is we're going to start on the outside portion of the foot, and then we're going to work our way around. So what I'm going to do first, so normally I would be doing this with two hands and doing this to a person, but for the purpose of the video, we're going to try it one-handed today. So what I would do is pull this foot up so that it kind of comes back a little bit and also out to the side just a little bit. So I'm going to pull it this way, out like that. That's going to be where we start our position or our taping from. So now I'm going to take my coverall and I'm going to start on what's called the lateral malleolus, which is this bump on the outside of the foot. And then I'm going to wrap it and I'm going to end right up here about on the tibia. Okay, so it's going to kind of make a swoop around and encourage this motion. So I'm going to make a quick cut here. This tape is very thin, and sometimes when you get towards the end of the roll, like I am here, it can kind of roll around on you. So we're going to do our best to not let it fold on us, which can be a challenge. Okay. Now we're going to start it again from this bump on the ankle, the lateral malleolus, which is actually part of your fibula. You want to angle it a little bit away so that you're able to go. Now it's okay if there are a couple of wrinkles in this. This is not a weight-bearing part of our body, so it's okay if there are some wrinkles. And then you want to pull it relatively tight, but remember, this tape is just a covering. It's not doing the actual work, okay? The next tape is what's a little more important. So now we have it kind of spiral around a little bit. Looks pretty good. And then we're going to take the leukotape, the thicker tape. And I like to kind of keep it on the roll as I go. We're going to start it right over here. We're going to try to keep it on the coverall. If it comes off a little bit, that's okay. Now remember, if you're taping someone else, you're going to kind of keep that eversion on it. So we're going to keep the eversion on it. And now I'm going to pull nice and tight like this, all the way up like that. Okay, nice and tight. So it should, and we're going to anchor it at the very end there. Okay. So it should feel when the person walks a little bit different, like they are doing something, like it is doing something, but they should have still full mobility of the ankle. And that's it.